The U.S. healthcare system is rapidly evolving, offering new models for delivering the highest quality care while reducing costs. Government entities and commercial health insurance companies are pushing these changes. One model to reduce healthcare expenditures is the establishment of care management teams. Care management teams are groups of nurses and caregivers focused on keeping their patients healthy and reducing their rate of readmittance to the hospital. Incite is developing solutions to streamline workflows for care management teams so they can focus on caring for their patients. We are Incite, and we're advancing national healthcare.
Good afternoon. My name's Kyle. I'm here with my co-founder, Sam, and we're here to talk to you about Incite. It's our business that's helping teams of care managers keep their healthy patients healthy and their sick patients out of the hospital. So we realize with that video, that's a lot to take in. So most importantly today, we want to introduce you to two people. The first being Sandra. She's a care manager and our customer, She is our customer, and she's been a nurse for the past 11 years. She's incredibly passionate about caring for her patients like Jim. Jim is a 60-year-old male. He has a family history of heart disease, and he just found out that he's pre-diabetic. So what Sandra's responsibility is really twofold with her patients. Identify the rising risk patients in her population. Those are people with conditions like Jim who may progress onto more serious chronic disease. And then second, to identify the high-risk patients in her population, very sick individuals, in the emergency room a lot, have multiple chronic disease like heart disease, diabetes. She needs to identify those folks and ensure that she provides optimal care to them. What that looks like is reaching out, giving them a call, coaching them on their medication, potentially visiting their house and coaching them on their diabetic testing supplies. The challenge she has is this is her patient population, not just Jim. She has 12,000 patients under her purview, so she has to do that identification to find all those high-risk patients, find all those rising risk patients, and only then can she develop that optimal care strategy and have that interaction with that patient to get them healthy. This is how she currently solves it, with 13 separate Excel spreadsheets, all disparate from her electronic health records as well as her claims management platform. So among many issues, the main one that it causes is these teams of care managers have extreme difficulty allocating their resources to improve the outcomes of patients like Jim. The financial implications of this are huge. They're mismanaging these patients on a day-to-day basis, as well as the fact that baby boomers, Sandra is already seeing them move into this rising risk and high risk category, so this problem isn't going away.
So Incite's developed a solution that will help Sandra and her colleagues spend less time on the computer identifying and prioritizing these patients and more time having these impactful interactions. We take electronic health record data and patients' claim data, and using clinical benchmarks, we're able to better identify and prioritize that patient population for Sandra, and we can output that in Incite's care management platform. So Sandra spends her time now with 13 separate Excel spreadsheets in front of her, but with Incite, she can have a simplified, streamlined dashboard where she can quickly identify which patients are most at risk and that she needs to interact with to ensure that they aren't readmitted back into the hospital and they don't become high risk. She can even dive deeper into her high-risk patients, just like Jim, and understand what care they've had, but more importantly, knowing now that Jim's a pre-diabetic patient, what care she can have going forward to ensure that he doesn't become diabetic, that he doesn't have a cardiac event. Utilizing Incite's care management platform, Sandra and her colleagues can save their organization $2.8 million per year, just by reducing the amount of readmittance to the hospital and ensuring that the proper care is taken for these patients. Speaking with individuals across the healthcare landscape, it's clear that the misalignment of incentives is what's driving up costs in the US. We don't want to be a part of the problem, we want to be part of the solution, and we took that into account when designing our business model. We can save an organization $2.8 million each year. We're going to take 10% of those savings using a gain-sharing model for the first year to really ramp up adoption by lowering that threshold of risk for these organizations. That'll provide us with $280,000 in revenue for each organization that we're helping, but more importantly, help us establish a value-based price that we can use going forward in years 2+ as we take on a more typical SaaS model. We've identified organizations just like Sandra's They're spending far too much time identifying and prioritizing patients and not enough actually taking care of these patients. That market's $283 million that we can target immediately. Looking at the healthcare systems that are using these care management teams, that's a much larger market at $17 billion.
At Incite, we're incredibly passionate about facilitating this conversation between care managers like Sarah and her patients like Jim. That odd but lovable character in the middle who we introduced you to earlier is Jim Johnson. He's my father, and he was diagnosed as pre-diabetic in 2013. Unfortunately, at that point, he wasn't identified as one of these rising risk patients, which ended up resulting in a cardiac arrest in 2015. Lucky for my family, the doctors were able to provide care and save him, but he lives daily with the deficit of having a major heart attack. Sam and myself have a ton of experience in the healthcare space, both on the clinical and consulting side. Shawnee Liu, who's on Zoom right now in class watching this, is our development lead. We're so thankful for her for leading the team of Jagger and Robert to develop the front end and back end. We've also been working with the eLab teaching team, and a special thanks to Andrea, our advisor, as well as Dr. Gelman, who's down at Cornell. Where have we been? We've been in eLab, obviously, this past year, and we've done over 100 customer interviews across the healthcare ecosystem. We've competed in competitions and programs. This past 2 weeks ago, we received a grant to continue our research and development. We actually just met this morning with a health system, and we'll be collaborating over the summer to further develop within a care management setting our solution, looking to have our first paying customer at the end of this year. Thank you all so much for your time. Specifically, thank you to the eLab teaching team. It's been an incredible experience within the Cornell entrepreneurship ecosystem. If you have any interest in what we're doing, healthcare, or if you know any care managers, we're still really actively speaking to them, so we'd love to talk to them. Thank you.